Okay, everyone. Well, while folks filter in, I think I'm going to get started. Welcome to the last session of today. All of us participants and researchers building a healthier future. My name is Michael Balkenhall, and I'm the engagement coordinator at the NNLM All of Us National Program. Quick housekeeping, this session is being recorded. It will be made available after the symposium for 30 days on the symposium website. And then after that, all recordings from today and tomorrow will be transferred to the NNLM YouTube channel for later viewing. Please use the Q&A and the chat function for any questions or comments and to find links to resources that we're going to share over the next hour. And while attendees filter in, I'm going to share a bit about NNLM and our partnership with the All of Us research program that kind of sets the stage for what we're doing today. All of Us is a research program of the National Institutes of Health, the NIH. The mission of All of Us is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us by building a data set of 1 million or more volunteers nationwide who will sign up to share their health information over time. The goal of the program is to help researchers understand more about why people get sick or stay healthy, and by looking for patterns, researchers may learn more about what affects people's health. At NNLM, we support awareness of All of Us through the NNLM All of Us National Program. We coordinate with libraries and other organizations through funding, training, virtual health programming, the creation of toolkits, and more. And before introducing our speakers, I want to share a bit about some of our activities. On this next slide here, I'm going to share a little bit about our All of Us virtual health programming. Since the beginning of the COVID-19 pandemic, the NNLM has offered a variety of virtual engagement opportunities for librarians, community organizations, and the general public. These virtual health programs have included a panel on vaccine development and efficacy, film screenings of Fauci and other documentaries, as well as citizen science webinars and other related events. Our programs have been presented in both English and in Spanish, and again, these have been for anyone, the general public. On this next slide here, I wanted to share our next event that's coming up at the end of April. It is an author talk with Whitney Stewart and Hans C. Anderson, the authors of Genomics, A Revolution in Health and Disease Discovery. And we also just released a book club kit about the book. The Genomics Reading Club kit provides everything you need to hold a book club discussion around genetics and genetic information. Recipients of the kit will receive 8 copies of Genomics, A Revolution in Health and Disease Discovery, a discussion guide, as well as supplemental health information materials to share with book club participants. And that's open to folks from any kind of organization, including libraries. And on this last slide, I just wanted to share about a researcher convention happening this week from the All of Us research program. The All of Us Researchers Convention provides an opportunity for a broad spectrum of researchers using the All of Us research program data and tools offered through the ResearchHub to showcase their work with their colleagues, peers, and others who share a passion for advancing health research. The 2-day virtual event will focus on researchers at various educational and professional career stages across 2 separate but linked events: the Minority Student Research Symposium, which is on Thursday, March 31st, and All of Us Science Day, which is on April 1st. And you can register at this link in vFairs. So if you're familiar with using vFairs today, it'll be a similar experience for this event. To stay in touch with the All of Us National Program, I'm just going to share our email as well as where you can learn more. It's allofus.nnlm.gov to hear about our activities with the All of Us National Program. And I'm going to share these out in the chat as well. So I can move on to our main event today. Again, welcome to all of us participants and researchers building a healthier future. I want to introduce our speakers for today. Ashley Green is the lead outreach coordinator and research analyst for the All of Us Data and Research Center. She is a member of the demonstrations projects team, where she works closely with demo project researchers as they work towards publishing their research. Her background is in information science and education, and she is passionate about access to data and information. And also Brian J. Castro. He is a health program and research associate at the National Alliance for Hispanic Health in Washington, D.C. At the Alliance, Brian assists in a variety of projects, including Todos Juntos, an initiative to promote the All of Us research program within Hispanic communities across the nation. Before his work at the Alliance, Brian completed a health equity research fellowship at the U.S. Department of Health and Human Services Office of Minority Health, and previously worked as a medical interpreter at the Virginia Commonwealth University Medical Center. And without further ado, I'm going to pass it off to Brian to get us started today. Thanks again for joining.
Good afternoon, everybody. Michael, thank you for the introduction, and thank you so much for allowing us to talk about our work with the All of Us research program and the Hispanic community specifically. I have here in the group Natalia Caña. She is my colleague at the Alliance. She has access to the chat and can also unmute and mute herself. So Natalia, if you want to add anything at the end or as we go, please feel free to do so. And again, Natalia will help us with the chat if there are any questions for us. Okay, next slide, please, Ashley. Okay, so the National Alliance for Hispanic Health, like Michael said, is based here in Washington, D.C. Our mission is best health for all, but our target populations are the Hispanic communities in the U.S. And in fact, we're the largest and oldest Hispanic network of community-based organizations in the country. And we serve 50 million people each year around the country. So we work in the areas of research, service, and advocacy, but really our work is always based in people, science, and culture. And we always believe that the solutions can always be found in the community. And a badge of honor that I cannot get away without saying, because we always mention it, is the Alliance does not receive any funds from tobacco, alcohol, or sweetened beverage companies. Next slide, please, Ashley. Okay, so before we jump into the research, the All of Us research program, we're going to talk first about Hispanics in the U.S. and Hispanics in research as participants and as researchers as well. And I'm sorry, I'm in my apartment and there might be some additional noise. So my apologies in advance for that. Okay, so to get started, there are 60 million people, 60 million Hispanic people in the US. So that is 18% or close to 1 in 5. Next slide, please. And by the year 2060, we'll be at 28% of the population. If you look on the leftmost bar, we were at 18%. In 2016, so you can see that we are projected to keep growing. Next slide, please. And so it's important to make sure that we understand the health of Hispanics, the health outcomes, health behaviors in terms of healthcare access, and also lifestyle behaviors, so that we can understand this population better. Next slide, please. However, unfortunately, racial and ethnic groups haven't been represented in research. So we can see that racial and ethnic and racial groups, minority groups, are 30% of the U.S. population, but we're only represented in only 18% of trial participants. Okay. And that's for National Cancer Institute studies. And then for FDA clinical studies, it's 17%. So you can see there's a disparity there. And if we look at Hispanics specifically, there's the disparity is even starker because we make up 18% of the population, like we said before, and we only make up, we're only 1% of clinical trial participants. Next slide, please. So what are some of the challenges that might impede Hispanics from participating in research? And so we have to look back at some of the history. And so Hispanic people, just like people from other racial and minority and ethnic minority groups, there's been a history of unethical research practices with our community. So obviously there's a bit of mistrust there. And so there's a necessity to really build goodwill and trust with the community before any meaningful conversations can be had. There's also the barriers of language in terms of, Hispanics are heterogeneous, so many Hispanics speak English perfectly well, but some have limited English abilities, and some as well that are from Latin America. People from Latin America have other languages, indigenous languages. So if they know Spanish, that would be their second, and if they have another language, that would be their third. So we have to keep that in mind that people from Latin America, we have other languages as well. And so Spanish, of course, is the low-hanging fruit, but then there are other languages as well. Tied to language, I think, and education is literacy, understanding. So literacy as just general education, but also health literacy, right? So being able to understand health and then understand research. And so that, I think, is also a barrier as well for people to understand what research is and kind of the benefits of long-term effects of research that is not so short-term or medium-term. There's also difficulties in terms of capacity from organizations in terms of locations. So we in a little while you'll learn about the All of Us research program, but we have centers in different places, and then inscription centers, whether they're university hospitals or labs. But we have to go where the community is. And so unfortunately, that is one of the limitations that has existed historically, that we don't always go to where the communities are. We don't have the capacity to do that a lot of times. So that's another thing that happens. And the other thing is technology. So people might not have the technology to be able to participate in research. So it's very important for us to be able to kind of bridge that gap as well. Also, concerns about privacy and confidentiality. This is not specific to Hispanics, but there are other layers on top of that. For example, if somebody who doesn't have legal residence in the country, that might be a barrier for them. They might be fearful that they might be tracked. Even people who are lawfully residing in the country, if they're in a mixed immigration status family, there could be some fear as well, right? If I'm a citizen, but my father isn't, how could my participation put, my family member at risk? So I think those are some of this list is not comprehensive, but these are just some of the factors that have really influenced and really made it burdensome and sometimes prohibitive to have Hispanics participate in research. Next slide, please. Okay, so now shifting, I told you at the beginning, we're going to talk about participants. Now we're going to talk about the researcher side. So we also see some disparities there. So we can see that if we look at Hispanics and African Americans, we can see that 7% and 4% respectively finished their doctoral degrees in 2013. But if you see less than 5% of NIH-funded principal investigators. So you can see that there's a disparity in there as well. And so if there is that disparity, then there isn't that knowledge of cultural proficiency, right? That, as a Hispanic, I might understand, again, as I was saying before, like going where the community is, where are the places where you can find the community? How can you talk to the community in a way that's meaningful to them? And that's something that the All of Us research program does really well, is really connecting to people to the principles, the underlying principles of research and why it's important to participate. And so also another deficit really is this lack of understanding the community and really implementing community-based participatory research models that really take into account the community and have them at the table when designing and implementing these studies. Next slide, please, Ashley. Okay, so now we're going to transition over to talking about the research program. And hopefully, as I talk about some of these things, I'll try to highlight how the program is overcoming these barriers that I mentioned kind of at the beginning. Okay, next slide, please, Ashley. Okay, so the All of Us research program, the goal is to have 1 million or more people in this research program that's going to last 10 years or more. And the idea is to really improve our knowledge of what's called personalized medicine, individualized medicine. You could use those terms interchangeably. And so it's prevention, it's treatment, care that is tailored to the individual based on a variety of factors, which, as you can see, might include lifestyle, socioeconomic status, environment, and biology. Next slide, please, Ashley. And so now we're going to jump in this slide and the next one. We're going to talk about a little bit about the infrastructure at the All of Us research program. And so this first slide that we're going to talk about the infrastructure is the promotion partners. You can see our logo there is in the center, the National Alliance for Hispanic Health. We work to promote the All of Us research program throughout the US. We have partners throughout the US who work within their communities locally to talk to the community through ambassadors or community health workers, whatever term you want to use, to talk with their local communities about this program. And you can see NNLM is also within this subset of partners. And you can see there are all types of organizations. And we have collaborated with different organizations within NNLM, with 54, for example, who works with people who are older, just different organizations to make sure that we are getting at the intersectionality of people's experiences and their backgrounds. Next slide, please. So you guys remember that I told you that the All of Us program is built in a way that, let's start in the middle. You can see right there, it says HPO, that's health provider organizations. These are university hospitals, VA hospitals, and federally qualified health centers, which already have capacity to provide medical services, and they also enroll in the program so they can take biosamples when for participants that are eligible to provide biosamples. If we look at the top, the participant center, there's a network of partners that work together for areas that are not covered through that middle band, the HPOs. For example, DC, where I'm at, we don't have an HPO in this area. So I have to go, for example, to a lab. There's a participating lab in this area, so I can go to that lab and provide my biosample, whether it's blood or urine or saliva. Next slide, please, Ashley. Okay, so kind of a high-level view of what the research program is doing. First, gathering information for the participants through surveys, through biosamples, and their electronic health records. And then researchers can go into the database, can look at the data to be able to do analysis of the data. Participants will be able to get research. And this is one of the things that is really exciting, because remember that I told you that, and it's just not for Hispanics, I think it's for a lot of us, like thinking about long-term, like what's the benefit for me as an individual participating in a research study, right? So the program has developed a few things that make it a little bit more interesting for people who, in addition to the long-term effects for the community, for the population of the US, there's also these short-term and maybe mid-term benefits of participating in the program. And those include the most readily available example that I can think of is the genetic return of results. So participants can see after giving their biosamples, they can get recreational traits, as they're colloquially called. For example, where's your ancestry? Are you, in my example, for example, 50% Southern European, 50% indigenous from the Americas, for example. So that would be one of the recreational traits. Or, for example, if I taste cilantro, does it taste like soap, or does it taste good? Those are some of the interesting traits that started already with genetic return of results. But now there's also, in addition, going to be a medical return of results, which includes the drug gene interaction, and also possible mutations that could be connected to some kind of disorder later in life or illness. And so now going to the final icon is that long-term goal, which is to really share the knowledge that is gathered from this data from participants, to be able to make generalizations about the data and if more Hispanics participate, if more racial and ethnic minorities participate, then it can be really generalizable to the population, not just a certain subset. Next slide, Ashley, please. So these are some of the questions that you might be able to answer. Or some researcher could go in and say, may slow or potentially stop different kinds of dementia. So these are, how do we prevent chronic pain that affect more than 100 million people across the US each year? So these are just questions. And the interesting thing is you can build, Ashley will talk about that. I'm not gonna steal Ashley's spotlight, but anyways, I'll leave it at that. But anyways, the point I wanted to make is you can look at different problems through different lenses and using different types of data. Next slide, Ashley. Okay, so the current protocol as it exists is, the first part is enrollment. So enrollment is open to anybody who lives in the US, who's 18 years or older. Children are not able to participate yet, but there has been discussions of possibly in the future. And so when people first enroll in the program, there are 3 consents that they have to fill out. One is the general consent for the overall program. Just like any research program, they have to understand what the goal is, and they have to understand the risk and benefit, things like that. They also have to provide consent for electronic health records. Now, they don't have to provide consent to electronic health records to participate in the program, but if they want to have a return of genetic results, then they do have to share. They do have to consent to share electronic health records. The third consent is to get DNA. So you can have, yes, I want my results, or the informed refusal, no, I don't want my results, or I'm not sure. So those are the 3 consents that you do at the beginning. Then there are these initial surveys that you complete: basics, lifestyle, personal, family, medical history, healthcare access, things like that. And then there have been different surveys that have been developed through the course of the program. The most recent is the social determinants of health, which is really exciting for those of us who work in public health. So that was just released in the last few months. And also before that, we had 2 different surveys. One was the Minute survey, and the other one was the COPE survey, which asked participants about COVID effects in their life, economic, health-wise, and later on with the Minute survey about vaccinations. Okay, so I told you that also participants, in addition to the surveys, can provide biosamples. So they can provide blood and urine, or they can provide saliva, and then that will be sent to the biobank. Lastly, people can also share their wearable devices. And sorry, I'm keeping an eye on the time, but I really wanted to jump back to the consent form just to throw a little tidbit of what I meant with kind of what we're doing, like what the All of Us research program is doing to kind of overcome some of these barriers. And so if we jump back to the first box, the enrollment and consent, the consent itself is done online or through an app on a smartphone. And the great thing, remember, literacy can be an issue. So they have a series of videos in English and in Spanish that participants can watch, and that can help them understand about the program. So that's like one example of how the program tries to overcome those barriers so that participants can better understand what research is. Okay, next slide, Ashley. All right, I think that's me. Thank you. Thank you so much.
Great. Well, thanks so much, Brian. And thank you so much for having us here today. I'm so excited to be talking about the All of Us research program to you all. I'm a former librarian. I was a librarian for 8 years, so I'm really excited that I get to come here and talk to you all. I am joined by my wonderful colleagues at the Data and Research Center. We've got Harold Master and Daniel Wolfong joining us. So if you have any questions, please feel free to drop them in the chat, and they would be more than happy to help. So today during our presentation, we are going to explore the ResearchHub and Workbench, and we're going to get an overview of all that we offer. We're going to learn about the types of data we have. We're going to explore our free public-facing tools on our All of Us ResearchHub, which is our website, and that's where we house the data. And we're going to learn the requirements for access and how to register. We're going to see an overview of the Workbench and how to start a research project. And then we're going to learn where to go to get support at any step during the research journey. So what is the All of Us Research Program? A lot like what Brian was mentioning, we are working toward advancing precision medicine for everyone. We do value our participants. Our participants are our partners, and we could not achieve of the science we hope to accomplish without them. So diversity is at the heart of the research program, and our data includes a diverse population of participants, especially those who have been underrepresented in biomedical research. Now, our data are longitudinal, including our surveys, and so that means that they follow the participants. And transparency is important to us, so we want participants to be sure they know how their data are being used. So the mission of All of Us is the acceleration of medical breakthroughs, and the program is working toward advancing precision medicine for everyone. We have 3 objectives toward that mission. Now, our participants are vital to the success of the program. Our goal is to have at least 1 million participants, and we're looking at delivering one of the largest biomedical data sets. Now, this is easy and it's free to access. And the way we present our data is through the ResearchHub, which is what we will be diving into today. So our data set is not only rich, it's also diverse. The program aims to reflect the diversity of the country. 78% of participants have at least one category of underrepresentation in biomedical research, which is what the acronym UBR stands for here. So we have at least 47% are of non-white race or Hispanic Latino ethnicity. 29% are over the age of 65. 10% have less than a GED. 27% earn less than $25,000 a year. And 13% are sexual and gender minorities. So now that we've had a chance to learn about the program and our amazing participants, let's take a look at the data we have available and how we curate them. So we have data from over 3,000 participants. We offer many types of data, including surveys, electronic health records, physical measurements, and wearables. Now, don't forget our data are longitudinal, and our COPE survey is our COVID-19 survey we sent out in 2020. Participants use this survey to record how the pandemic was affecting them over the course of several months. Now, on March 15th, just a few weeks ago, we did add our genomic data, and we are still in the beta phase. So currently we offer over 98,000 whole genome sequences and over 165,000 genotyping arrays. Now, the genomics data is only offered in our control tier, and we're going to go over the different levels of access to data we have in a few slides. So our data go through a thorough curation process. Participant level raw data undergo quality control in our curation process to ensure participant privacy, and they are harmonized and curated for quality control. Now, we use the OMOD data model. The data are kept on a secure cloud-based platform on the ResearchHub. And All of Us uses high quality security technology and strict privacy and security protocols to help keep participant data safe. So when it comes to data, we believe in sharing both widely and wisely. Access to the data is broad and open, and we've removed barriers to access for researchers, but we are wise about how we share our data so that we protect our participants' privacy. We balance the need for access to the data with the need for protecting our participants' privacy. So to enable these principles, we have created tiers of data. So what you're seeing here is what many of us call our birthday cake graphic with different access levels that we have. So we're going to start on the bottom layer, and we're going to work our way to the top, from broad access to more controlled. So the public tier is a summary of what we have. It is aggregate data, and we round up by 20. Now, anyone can look at this data by using our data browser, which can be found on our ResearchHub. And we're going to go into the data browser in a few more slides. So the level above that is the registered tier. Now, this was our first launch of data we released back in 2020. The registered tier is our row level, participant level data, and it exceeds our HIPAA standards. Researchers must be registered and approved to access it, and they access it through the Workbench. Now, in this level, we have removed all direct identifiers and all free text data, as well as obscure the date of health-related events. Also, all dates are shifted backwards by a random number between 1 and 365. And the shift is constant for each record, so temporality of events is preserved. Now, right above that, we have the control tier. And this is where our genomic data are located. Now, in addition to genomic data, we have more granular data from the registered tier, such as the first 3 digits of a participant zip code. Now, researchers must complete additional training in addition to the training from the registered tier to gain access to the controlled tier. And our last tier, in the future, we plan to have individual biospecimens and participant data available. So we've seen our tiers of data, but you may be wondering what the difference is between the registered tier and the controlled tier. Now, for both levels, you will have to register and go through mandatory trainings, but the control tier is an additional level of training you must complete before you will have access to that tier data. Now, in the registered tier, the row level data have had many identifiers removed, such as dates are obfuscated and only state level geographic data are available. Whereas in the controlled tier, we have the same data as in the registered tier, but they are on a more granular level. So you will have unshifted dates and you will have expanded demographics. You will have COVID EHR data, as well as, like I mentioned earlier, the genomic data. So in a few slides, we're going to see how to register and how to gain access to both of these tiers of data. So the registered and controlled tier data sets we just saw are available to researchers in the curated data repository. And these data are pushed through our pipeline about twice a year on average, after they have undergone the quality control process we saw earlier. Now, to access this data, you'll first need to visit our ResearchHub, which is our secure Google cloud-based platform. So now that we have explored the data types we offer, we're going to go ahead and look at our ResearchHub. And remember, the ResearchHub is our website that is home to both the public and the registered data. So now, while I can't go over everything on the hub today, I will go over quite a bit. So I encourage you to follow along at researchallovus.org. So what exactly is the ResearchHub? Well, the ResearchHub is a secure cloud-based Google platform that contains the public data available to everyone to view, as well as the controlled access data that requires registration to view. So here on the public portion, researchers can learn about the data, how to use it, as well as the tools available to analyze it. Participants can use the hub to see how their data are being used by researchers, which is one of the ways that we maintain transparency. So the hub offers many tools that could be viewed by participants, researchers, and the public. And the restricted access portion of the hub contains our researcher Workbench, and it requires a researcher to register to gain access. And this is where the researcher can access the row-level data set we examined earlier, as well as tools that we have created to analyze the data. Now, on our public portion of the website, we offer a variety of unique ways to learn about our participants and to interact with the data. Now, these tools include the data snapshots, the Survey Explorer, and the data browser. So we're going to go ahead and take a look at each one. So the data snapshots page can be found under the Data and Tools tab, or you can access it directly from the main page. Now, this page gives an overview of the aggregated public-facing data, and it is updated daily. The snapshots provide participant demographics, geographic distribution, and more. It also provides the numbers of enrollment counts over time, so you can see how fast the program is growing and how close we are to getting to enrolling 1 million participants. I always enjoy coming here every so many days to see how fast the participant numbers are increasing. So the Survey Explorer lives under the Data and Tools tab as well. And participants in the All of Us research program respond to surveys spanning a variety of topics that Brian mentioned earlier. These include demographics, healthcare, and lifestyle. Now, participants complete the core surveys, and these are the basics, overall health and lifestyle, and they may complete additional surveys on healthcare access, personal and family medical history, and other topics. And our COPE survey, which is our COVID-19 survey I mentioned earlier, can be found here as well. So the data browser is also located under the Data and Tools tab. This is one of my favorite things that we have on the ResearchHub. And the browser provides interactive views on the publicly available participant data. Now, anyone can learn about the data types and the quantity of data that all of us collects. This is where the aggregate data are located. And that's that lower level, that birthday cake tier that we looked at. So they are de-identified. They are rounded up by 20, or 220, excuse me. And users can explore the aggregate data, including electronic health record information, survey responses, physical measurements, and wearables data. Now, it's not updated daily, but it's updated about twice a year. And we can use the search tool at the top to examine topics of interest, and the results will automatically be generated below. And it'll show you all of the data types we have available related to your topic. Now, this is a great way to see if your research is feasible with the research available. And I highly recommend going here first to see if we have the data you need for your research project. So we are committed to being transparent to our partners about how their data are being used and shared. We showcase researchers' publications on the ResearchHub, which can be accessed by the public under the Discover tab. So if you're interested in seeing the published manuscripts of researchers who have utilized all of us data, this is a place to go. And it also lists all of the projects being conducted by researchers. So the research directory is also located under the Discover tab. This lists all of the current research projects researchers are conducting. Now, when registered researchers begin a new workspace on the Workbench, they provide their project's research purpose, description, populations of interest, and more. And this information appears on the research project directory, and it helps all of us to ensure transparency on the type of research being conducted. You can search by name, title, keywords, scientific question. And what's great about this is that even though it's not updated daily, it is updated weekly. So since the launch of the research platform, over 1,000 researchers from diverse backgrounds have registered on the research platform. And this slide shows a breakdown of the educational and role backgrounds of researchers. And you can see that we have a large population of early career and trainee researchers. Now, while doctoral level education is the highest, we do have undergraduate and graduate researchers. So our researchers are examining multiple topics, and you can see on this chart some of the research being conducted. Now, disease focus is the most common, but other types of research, such as social and behavioral research, are being explored by our researchers. And since our genomics just recently launched, we are getting more genomic research projects going on. So the publications page lists the peer-reviewed articles all of us researchers have published. Now, this page includes links to the articles. We require researchers to alert us when their manuscripts are being published 2 weeks before publication. And then we like to list them here to celebrate their amazing work. So our COVID-19 research initiatives page is a newer addition to the ResearchHub. The All of Us research program has taken steps to support COVID-19 research in a number of ways. So on this page, you can learn more about the COPE survey, a spotlight article featuring research using the COPE survey to explore the pandemic's effect on physical and mental health, COVID EHR data, and the COVID antibody study and results. So now that we've looked at the data we offer, if you're ready to explore the row-level participant data, you will need to register with us. So you can apply for access and register by clicking on the register button at the top of the ResearchHub. There are 6 steps to complete. Step 1 is already completed for you because we've already looked at the data available, so we can move on to step 2. So in step 2, you must be affiliated with an institution that has a data use and registration agreement with us. And so you can click on the link that's in step 2 to find your institution. Now, we are still in the beta phase, so currently only US-based academic, nonprofit, or healthcare organizations can enter into our data use and registration agreement, and only US-based researchers can register. Now for steps 3 and 4, once you have checked to be sure your institution has an agreement with us, you will register and verify your identity with login.gov. And in steps 5 through 6, you will complete the code of conduct training and sign the data user code of conduct. And what's great about steps 2 through 6 is that they can be done all at once or as you go along. And it typically takes about 2 hours to complete. And we do offer new user orientation when you register and an amazing support hub to help you with any questions you may have, as well as video tutorials. And we're going to explore these and a few more slides. Now, when you go to the institutional agreement page that we saw on step 2, you will find several pieces of information. First, you will see the listing of all the institutions we have in place with us. They are listed in alphabetical order. Then you will see the level of access the institution has agreed to have for its researchers. All that are listed, all the institutions we have listed already have access to the register tier, but only some have requested access to the control tier for the researchers. So if you or another researcher are at an institution that has not signed up for the control tier access, on the right-hand side, you will find the name of the contact at your institution that we have on file. So if you'd like to have access to the control tier and your institution has not signed up on it yet, just reach out to that contact that we have listed and they can get the process started for you. Now, if you encounter any questions when you register, our support team is here to help. On the website, you will see a button on the bottom right-hand side that says help. Click on it and you'll be able to reach out to our help team, and especially if you are encountering any issues with login.gov. So we do have a lot of tools and resources to help researchers on their journey. We offer $300 in credits. That money is used when you run the analysis of your data. And our support team is available to help answer any questions you may have, for the basic to the very detailed, including coding issues. And we love celebrating researchers and their work. So we have many opportunities to showcase researchers, from being part of presentations to audiences like this, to being featured on our website. And our platform and tools can really help enable your research and can be used for dissertations, poster presentations, and other projects. So now that we've looked at the public-facing data on the ResearchHub, we're going to explore the researcher workbench. And we're going to see how to get started on your research project. Now, don't forget to explore our data browser first, that we saw earlier, to see if we offer the data you need for your project. So the workbench is where the restricted row-level participant data live. All researcher workbench analyses happen within the context of a workspace. And a workspace is your place to store and analyze data for a specific project. So after you've completed the registration and are ready to begin, you will receive an email that will have your login information once your account is set up. So that's when you know you've got the green light, you're good to go. And so to get started exploring the Workbench, once you have access, you will just click on Register Login at the top of the ResearchHub. So what exactly is the Workbench? The Workbench is where you will create your research by creating a workspace. Now, a workspace is where you will build and analyze your data set. You can access our point and click data analysis tools here. And in a workspace, you can select participants based on specific criteria using the cohort builder tool. Now, another tool, the dataset builder, allows you to select the variables and values of interest or concepts that you are interested in researching in your cohort. You can then save and export your dataset to a notebook and begin analysis. And we do have resources to help you with our tools and analysis, which can be found throughout the user support section of the Researcher Workbench. This includes the featured workspaces that were created to assist you in learning about the All of Us dataset and data analysis tools. And it's a really great feature in the Workbench is that it does enable and facilitates team science. So workspaces are collaborative, so you can share with your research team, whether they are at your institution or at a different one. However, all of the team members must be registered with us. And what's really great about this is if you have a research idea or a scientific question in mind, but maybe you're not familiar with the coding to run the analysis because you'll need to know code to run the analysis, you can add a team member to your workspace and the other member can run the analysis. So when you log in, the landing page shows you the workspaces you've created, as well as those that have been shared with you. And you can see my workspace here on this slide. I have a couple of workspaces on asthma since my father suffers from it, and I'm interested in conducting research on this disease. You will also see your recently opened items so you can quickly access them. And at the bottom, the bottom contains some tutorial videos to help you along the way. So to begin creating a workspace, you're going to click on the plus sign button you see at the top. Now, All of Us uses a data passport model. We approve the user so you don't have to have a research project in mind when you first register. And you do not have to gain IRB approval from us. In fact, we have several researchers who create a workspace just to test the data first and then explore it. And as part of this data passport model, we do ask for a detailed description of your research each time you create a workspace, even if you are using it to explore the data. So after you click on the plus sign that we saw 2 slides ago to create a workspace, you will be taken to the page you see here on the left. Now, each researcher must fill out all the fields, and the banners next to each field will denote if it will be publicly displayed on the ResearchHub under the directory that we saw earlier. So we do ask that you be as detailed as possible. Now, you can edit your description as your work progresses at any time. And on the right, you can see a research project and how these fields appear in the project directory. Now, under the About tab of your workspace is where you can share your workspace with other collaborators and assign them a role. Now, if you need to know more about each role, you can just click on the eye icon on the right side of the screen, and that'll give you the information you need. So the Data tab is really where the fun begins and where you can access our point and click tools. Now, this includes the cohort builder for selecting the participants to include in the data set. And the concept set selector is a data set tool for selecting the variables and values of interest that you want to research in your cohort to be used in the data sets. Now, as you can see on the right-hand side, we do have help tips that describe what the cohorts, concept sets, and data sets mean in case you need them. Also, the Workbench does offer that user support help to help you along the way. So for my research project on asthma developing in adults, for my cohort builder, I included participants over the age of 25, all genders and all races and ethnicities. Now for my concept set, I included asthma, EHR data, physical measurements, and surveys. Now, once you build your cohort and select the data you want to analyze, you will save the data set and export it to our Jupyter Notebooks to begin the analysis. So the Jupyter Notebook is an analysis tool where you can use human readable language and code to narrate your analyses. You can think of it kind of like your lab notebook. Currently, Jupyter Notebooks are in Python coding languages. Now we do have a workspace created with code snippets that you can use, as well as other tools to help you with R Python. And you can find this in the featured workspace section and the Workbench drop-down menu. Now please note, you are not able to download the data and take it off the cloud. And this is done to ensure participant privacy. So what you see here on the screen is one of our colleagues' notebooks, and it's located in the featured workspace section of the Workbench, and it's available for any researcher to use. And this notebook was created specifically to be a tutorial on how to get started, and it includes how to install packages and do common queries with the data. So today we've given you a high-level overview of the platform and tools, and now we're going to examine the many support tools we offer to help you along with your research journey. So the featured workspaces in the Workbench is where you can access the tutorial workspaces. And these workspaces offer example notebooks and how to work with the data. And what's great about them is that you are able to duplicate them and edit them on your own Workbench. And they also provide help for coding. So the support team offers new user orientation each month, as well as office hours to help you answer any questions you may have. We have drop-in office hours bi-weekly on Tuesdays at 1 o'clock Central Time, where you can come at any point in the hour and ask your question to our team of experts. And on Fridays, we also have office hours. They're also bi-weekly at 1 p.m. Central Time. And they have themes on how to use the data and tools and are led by our experts and analysts. And these are recorded and posted on our platform, so you can watch if you're unable to attend. And our support hub offers a comprehensive set of resources to help you with your projects. In the user support hub, you will find articles to help guide you through your data analysis journey, additional documents and links to resources to provide a more comprehensive look at the data set and how to use it, as well as a forum for asking the experts. Now, in the support hub, you will also find our FAQs, videos, and announcements for new updates. And you can contact our help desk with any questions you may have. They're very responsive and they will answer you within 1 to 2 business days. And you may also access their contact information on the support hub or on the main website on the help button. So we do hope that you will join our growing community of researchers. Don't forget, we do have the All of Us program researchers convention this week. We hope to see you there. And thank you so much for having us. And Michael, I will toss it back to you.
Great. Thank you so much, Brian and Ashley. I really appreciate you being here today. If anyone has any questions, comments, you're welcome to drop them in the chat. We'll keep an eye out for a minute or two for those before we pass it off for our closing announcements.
And if you think of a question after we're gone, you can always ask us on our support hub, and you can always contact us that way.
I'm just going to give folks another minute or two in case they're typing out a question. It looks like we do have one, and I'm happy to read it off for whoever wants to take it. Is this data also being used or could be potentially used for teaching purposes?
Oh, that is a great question, Tess. And the answer is yes. We do have teachers currently on the Workbench who are using it to teach their students. In fact, we had one professor from a university. She spoke at one of our on-ramp events over the summer, and part of her semester-long program for her students is she taught them the Workbench. They gained access to the Workbench, and they ran their own. They did their own projects. Also, with the Minority Student Research Symposium we've got coming up, we had a lot of students just using the data browser, and they learned how to use it that way. We're also in the process of creating support materials for instructors and educators, and so that they can create their own lesson plans and learn how to use the Workbench. So yes, this has been used by many educators for research and for instructional purposes.
Any other questions or comments?
The only thing I would say is from the Alliance perspective, if there are any individuals that work with a community-based organization who is interested in learning more about all of us in terms of outreach to the community, if you have a group that might be interested, let us know. Natalia, if you don't mind putting in our emails, just so that people can have that for reference, just let us know if you have a captive audience.
I'm also going to put my email, so if you want to reach out, we'd love to hear from you as well.
Perfect. Yeah, it looks like we've shared a bunch of links. And again, if you're interested in learning more on the library side of things and engagement in libraries around the NNLM All of Us National Program, please feel free to reach out for me. I dropped a link back there as well, and I'm going to kind of reshare those while we kind of wrap up for the day. But without further ado, I think we're going to close the symposium, and I'm going to introduce Martha Meacham. Martha is the project director here at the NNLM for our closing announcements. And off to you, Martha.
Thank you. Thank you very much. Thank you all so much for being here. It has been a wonderful day of learning, and I hope you all have gotten as much out of the day as I have. I wanted to share a few things that I've learned and appreciated. In the pre-symposium, we learned a lot about what to think about and consider as we do research, collect data, and then how we can most effectively share that information back out, especially through visualizations. I really appreciated the keynote from Dr. Mullins and D1 Patterson. The phrase that that I'm going to take away from that keynote is sharing perspectives. Though they're engaged throughout their engaging presentation, the themes of collaboration with communities, communications, and the importance of relationships really resonated. I did have to hop around the concurrent sessions during the afternoons, but some of the notes I took, a major takeaway from enhancing trust and inclusion in medical research among diverse populations were some of the real world examples of how diverse teams can be successful and impactful. And from Lisa Federer's Beyond the Paper, I was impressed with the point of how important getting the results of research out into the world for transparency, reuse, and generally increasing data's impact. In the next session, I was shocked to learn more about the project from University of Denver and the importance of making historical data available. Work like this is fascinating and often hidden, and the data can really greatly inform future work. And much of the information in Gregory Marcus's presentation was new to me and greatly informative. I certainly am leaving with a lot of things to research and investigate. And finally, in our keynote that we just heard, We heard about the grand scale research being done through the All of Us research program and the exceptional partnership with the National Alliance of Hispanic Health. I hope you all have your own notes and your own takeaways that were just as informative as I found them. After all of that, we have another exciting day tomorrow. I hope you can join us to learn and interact more. I'm confident that it'll be just as informative and engaging as today. A few notes before we go. There will be an evaluation opportunity at the end of day 2. This will be a separate evaluation tab that you can find in the lobby area. Filling out this survey is greatly appreciated, and it is also the way that you'll be able to claim the Medical Library Association continuing education credit if you so desire. Finally, I want to give a huge shout out and thank you to the planning committee for this event. I am very proud of these colleagues that I get to work with. Specifically, I want to thank Tony Gwen, Heather Holmes, Jessica Killam, Peace Awesome Williamson, Emily Tra, Michael Bockenhall, and Rebecca Brown. This is an incredible achievement and an amazing amount of work. And these are some of the great colleagues that I have at the network of the National Library of Medicine. So thank you. And with that, have a wonderful evening, and I hope to see you all tomorrow. Thank you.